Insulin. The discovery of insulin was no doubt a major breakthrough in medicine. Prior to its discovery, diabetes sufferers often died at a young age. But while Canadian scientists Sir Frederick Banting and Charles H. Best, along with their colleagues, are often credited with the hormone's discovery and isolation, the Romanian physiologist Nicholas Paulescu appears to have beaten them to it. Paulescu isolated a substance called pancrein, presumably insulin, in 1916, when he succeeded in developing an aqueous pancreatic extract, which, when injected into a diabetic dog, proved to have a normalizing effect on blood sugar levels. But he was soon after recruited to serve in World War I. After World War I, Paulescu resumed his experiments, and his positive results proved insulin's anabolic effect on all intermediate metabolisms. In 7 subsequent experiments, he showed the resultant decrease in blood and urine urea levels, ketonemia, and ketonuria. He finally published his findings in 1921, though they were overshadowed by the release of the Canadians' report early the following year. Aspirin. In 1899, Farbenfabriken Formals Friedrich Bayer und Compagnie, later Bayer AG, introduced aspirin, a pain reliever that would come to rank high among the world's most commonly used drugs. The company credits the synthesis of pure acetylsalicylic acid, aspirin's active ingredient, to Bayer chemist Felix Hoffmann. However, decades after its introduction, former Bayer chemist Arthur Eichengrün cried foul, claiming to have invented the process of the compound's synthesis himself, with Hoffmann merely carrying out the procedure. Bayer holds by its claim that Hoffmann was the inventor. Aspirin is sometimes used in the prevention of certain diseases, though its role as a preventive agent is controversial because of the risk of adverse effects. For example, daily intake of low-dose aspirin, 75 to 300 milligrams, was associated with a reduced risk of heart attack or stroke in high-risk individuals. In addition, studies found that long-term use of low-dose aspirin potentially lowers the risk of colon cancer in some persons and is associated with a reduced risk of death from several types of cancer, including certain forms of colon cancer as well as lung cancer and esophageal cancer. Chlorpromazine. The introduction of the tranquilizer chlorpromazine in the 1950s represented a turning point in psychiatry, one that gave rise to the psychopharmacological revolution. Indeed, not only was chlorpromazine successful, by 1964 some 50 million people had taken the drug, but its development also laid the groundwork for the later generation of agents used in the treatment of anxiety and depression. Furthermore, the characterization of its effects on neurotransmitters and their receptors provided insight into how impulses are passed from one neuron to the next in the brain, leading to major advances in scientists' understanding of mental illness and cognition. Potent synthetic tranquilizing drug that acts selectively upon the higher centers in the brain as a depressant of the central nervous system. It is used in the treatment of persons with psychotic disorders, like schizophrenia and bipolar disorder. Mechlorethamine. Nitrogen mustards were developed in the 1920s and 30s as agents of chemical warfare. By the 1940s, however, at least one of these compounds, HN2, also known as mechlorethamine, was better suited for use in the fight against cancer, specifically against human lymphomas, than it was in the fight between Axis and Allied powers. In 1949, mechlorethamine became the first drug approved by the U.S. Food and Drug Administration for the treatment of cancer. Mechlorethamine is also used to treat mycosis fungoides, a type of cancer of the immune system that first appear as skin rashes, certain types of leukemia and lung cancer, but is no longer commercially available in the U.S. And there's some reasons. Mechlorethamine is extremely toxic and can cause severe side effects, including bone marrow suppression, nausea, vomiting, blistering of skin and mucous membranes, and long-term risks like secondary cancers. And as medicine evolves, newer drugs in the same class, alkylating agents, such as cyclophosphamide or ifosfamide, are more stable, easier to administer, and often more effective or better tolerated. Zidovudine. The U.S. Food and Drug Administration's approval in 1987 of zidovudine, more widely known as AZT, was a breakthrough in the treatment of HIV/AIDS. While not able to cure the disease, the drug was found to prolong the lives of AIDS patients. It also was the first of the so-called nucleoside reverse transcriptase inhibitors, a group of antiretroviral drugs that became a cornerstone of HIV/AIDS therapy. Owing to these drugs, and perhaps most significantly, to increased access to these drugs in countries worldwide. The annual number of deaths from AIDS declined in the early 21st century. While AZT is effective in inhibiting viral replication, HIV is capable of mutating and thus of developing resistance to the drug. Patients receiving combination therapy with AZT or with other NRTIS are closely monitored to determine when the efficacy of the drugs decreases. Birth control pills. In the early 1920s, Austrian scientist Ludwig Haberlandt published a paper suggesting that hormones could be used as an effective means of contraception in animals. While it is unclear, he may have soon after tested a hormone preparation in clinical trials, despite heavy criticism from colleagues who considered contraception to be taboo. Haberlandt's work, however, came to an abrupt end with his suicide in 1932. 2 decades passed before further clinical trials of hormonal contraception were conducted in humans, and then largely at the urging of social activist Margaret Sanger. The first birth control pill was approved in 1960 in the United States. Birth control pills are a type of contraception that's 99% effective at preventing pregnancy when taken consistently every day. The pill contains hormones that regulate menstruation, decrease PMS symptoms, lower the risk of ovarian and uterine cancers, improve acne, and treat endometriosis. Penicillium. In 1928, Scottish bacteriologist Alexander Fleming was in the process of sterilizing bacterial culture plates that had become contaminated with mold. The mold toxin responsible for killing the bacteria turned out to be penicillin, which Australian pathologist Howard Walter Florey and British biochemist Ernst Boris Chain later successfully isolated and purified to produce what became arguably the world's most effective life-saving antibiotic. Incidentally, Fleming seemed to thrive on contamination. His other major discovery, of the antiseptic enzyme lysozyme in 1921, was made after he had accidentally contaminated a culture plate with his own cold germs. He first observed that colonies of the bacterium Staphylococcus aureus failed to grow in those areas of a culture that had been accidentally contaminated by the green mold Penicillium notatum. He isolated the mold, grew it in a fluid medium, and found that it produced a substance capable of killing many of the common bacteria that infect humans. All penicillins work in the same way, namely by inhibiting the bacterial enzymes responsible for cell wall synthesis in replicating microorganisms and by activating other enzymes to break down the protective wall of the microorganism. Thanks for watching and for the support in the last video. See you next time.